All right. Hi, this is Dr. David Tenner. We're here in Tyrone, Georgia at the Goldberg Tenner Clinic, where we specialize in the reversal of chronic disease. And I'm delighted today to be joined by Leah Lucas, one of our favorite patients. We've been working with Leah for approximately a year. It's May 2021. We saw her May of 2020 initially, and she has done very well under our care. She's going to share a little bit about her experience. So Leah, tell our audience what brought you in originally and what concerns that you had.
So initially came in on the heels of some pretty significant digestive stuff, just experiencing a lot of bloating and discomfort after I would eat. Couldn't really pinpoint why or if there was any particular food causing the issue. Just anything I would eat was just significantly uncomfortable.
Okay, so some digestive issues, and as I recall, you're also concerned about your weight. You want to lose
Yeah, I had put on, I don't know, between 20 and 30 pounds over probably a 5-year time period. Was working out regularly, but wasn't really seeing any kind of, downward trend.
Okay, and we do see patients certainly that have weight issues, sometimes overweight, sometimes underweight. And we never put people on a weight loss or even a weight gain program. The priority with each patient is to get things working right and to build their health. And as a result of getting healthy, the person that needs to lose weight will lose weight. The person that needs to gain weight will gain weight. And so we always take the priority of working on the patient's health first, and then in almost all cases the weight goes naturally where it needs to. So we did a thorough evaluation with Leah and got some lab testing done, took a look at her habits, and developed an individualized program for her. And she's from Alabama, so we worked with her from a distance for a while, had her come in for periodic visits to check in. And Leah, it's been about a year now, and what kind of changes have you experienced?
I've lost around 20-25 pounds, and the digestive issues are no longer, thankfully.
And so Leah has certainly done very well. She's been an excellent patient. It always helps when the patient works hard and follows through, and she was very diligent and certainly has earned all those good improvements. And we're going to show some before and after pictures. I'm going to splice those in and show the differences, the change in her body as a result of doing the right things. And this was a result of all the hard work she put in implementing the steps. These were not treatments for symptoms, but rather working to create all the right conditions, implementing all the right habits, so that her body can normalize and things to come back in balance.
Because I went to the medical doctor initially for the digestive issues, and their solution was to put me on a proton pump inhibitor, thinking that I had some sort of, reflux issue or whatever. I did not end up taking that, but that was going to be there.
And that was a good decision, and that's a very common scenario. Just real briefly, patients when they go see a gastroenterologist, I'd say about 50% of the time end up walking out with an antacid. And there's a long video, and I shouldn't say a long video, there's a short video, it's about 4 to 5 minutes on our website, talks about the hazards of antacids and the problems that they cause. I mean, essentially they interfere with digestion and will eventually make any digestive issue worse, in addition to creating the potential for new health problems. So rather than, again, give treatments, as I had mentioned before, we isolated the reasons why that was happening and changed her habits and got her doing the right things. And certainly has been good results.
Definitely.
All right. Well, Leah, we're delighted with your progress and appreciate you sharing your experience, and look forward to many years of good health for you.
Thank you. Appreciate y'all.
You're welcome.